Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we are talking about iron, the highs and the lows. ExpressCare's Dr. Jitka Lom is with us in the studio telling us about iron deficiency as well as having too much of it. So before the break, we talked a little bit about hemochromatosis, which is if somebody has too much iron, the iron storage disease, right?
Right.
So we wanted to talk a little bit about how it's treated if
Right.
somebody has too much and maybe the lifestyle changes that they need to make.
There you go. So I love to find when somebody has this problem and they're diabetic because it's a reversible cause of diabetes. So we measure their iron in their blood. We notice that the number should be on this ferritin number, maybe 100, and sometimes it's 800 or 1,000. It's very high. So to remove iron from the body, it's a very simple treatment. We just take their blood. So they go over to GMH and they have a pint of blood removed every other week. And by bleeding it out, you remove excess iron. Your body has to use up the iron that's stored in your liver, and you clean it out, and they get well, and they feel so much better. And their blood sugar drops, and it's all good. Such a simple treatment, no drugs involved at all. And then, of course, they don't want to accumulate more iron, so they shouldn't eat meat or as little as possible, and get their protein from fish or from nuts and those type of things. But periodic blood draws are basically all that's required.
And so that's a good, with it being Lent,
yes,
it's a good time,
yes.
actually, probably
it's
for these
It's a great
individuals.
time. If you're a new diabetic, please do get your iron level checked, because it's a very, very good way of treating your diabetes. Just take a little bit of blood off every other week, and you don't have to be on pills and drugs.
Now, when they donate the blood, can that be used?
Unfortunately not. Unfortunately not, because it's a disqualifying condition. So the blood is just discarded.
Okay,
Yeah.
good to know. And then how often do people, you said once a week, how often do people get treated?
What we do is find out where their number is, and then they go about every other week. It takes about an hour to take a pint of blood off, and then every third or fourth treatment they get a blood test to see how is their iron level dropping, and when it reaches a nice number, then they're okay for a while again, and periodically we check it a couple times a year to make sure they're okay.
So is iron deficiency or iron anemia and hemochromatosis, are they hereditary?
The hemochromatosis is, and it's interesting because the genetic test that is developed, and you can have it done, tends to apply more to people from Scandinavia and that part of the world in Northern Europe, because that's where the disease was originally identified. But now that we can see that there's so much of this problem of iron overload in Asia and in the Pacific Islands, there isn't yet a genetic test that's applicable here. Mm-hmm. But we can just at least measure the iron levels and then bring them down. Okay. As far as iron deficiency anemia, that one tends to not be inherited. It tends to be due to health conditions like we talked about, bleeding or not having adequate iron intake.
Okay, and so to wrap up on the topic of iron, you mentioned earlier about some foods that are rich in iron. Maybe for those, it's a good thing for those who don't have enough iron, and then it's a good thing to know what foods are high in iron, so people that have too much iron can maybe stay away from. So what do you recommend?
So the food sources that are rich in iron are those, again, that are red and from animals, so meat, especially liver and kidneys, the organ meats. As far as vegetables, the dark leafy green vegetables like spinach and kale, those tend to have a lot of iron because they absorb it again from the red earth. As far as other sources of iron, you would have to check your supplements very carefully, because many people are taking a vitamin or multivitamin and they don't know that there's iron included, or they think there is and there isn't. So if you're a young woman, you may need some extra iron. If you're an older man, you probably don't need any extra iron at all in your supplement. So check your multivitamin.
And earlier you mentioned about being pregnant, and I remember that was one of the things we had to take was iron pills.
Yes.
Why is that so important for a woman that's pregnant?
Yes, because she needs more oxygen for herself and to feed her baby. So she actually develops a much higher circulating blood volume. Her blood volume goes up by about 30%. She has that much more blood in her system. So to create that blood, to make that blood, you need iron. So she's going to be taking iron supplementation, and many women hate that during pregnancy because yeah, because it makes you sick. You're already nauseated. Now you're taking iron. It makes you constipated and sick. So unfortunately, you still have to do it and take small amounts, space it out. For the constipation, drink some prune juice and just tough it out, but you need it for your own health and for your baby's health.
I think I'd rather eat a bag of spinach. Well, thanks,
it's true.
Thanks, Doc, so much for coming in. You're always a wealth of knowledge, so we appreciate it.
You.
Next week, we got a treat for our viewers. We'll be heading to the ExpressCare clinic, and we'll be talking about psoriasis as well as light therapy that Doc offers there at her clinic. So we're excited to share that with you. We are back to wrap up the show right after this. Stay with us.